And hello, I work in the College of Human and Health Sciences at Swansea University, and I'm pleased to have the opportunity today to talk with you about understanding health inequalities around mental health and deafness to explore some digital possibilities. So, just in terms of an overview, I'm going to start by giving you some background, exploring the problem, looking at some of the challenges and reasons in terms of research, and then going to think about exploring finding some solutions together. Let's have some context. So in deaf communities, people talk about little d. What does that mean? So little d or lowercase d refers to people who experience hearing loss. As we get older, many people need to wear hearing aids and find that they are struggling with their hearing. That's different from capital D or big D deaf. And so what we find is that people who use capital D deaf identify as being part of a unique cultural group. Maybe they have been born profoundly deaf, perhaps use a sign language like British Sign Language, often referred to as BSL. So little d and big D deaf are an important context. So I'm going to talk to you today in terms of some of the health inequalities that exist in deaf communities. So we know that health inequalities are very much about unfairness, disadvantage, often leading to poorer health outcomes for people. And there are a number of reasons why these health inequalities exist for deaf people. Let's think for a moment about our health services. We have had an over-reliance on audio services. So if I've been referred to a clinic or a hospital, chances are I'd get a letter telling me to ring and confirm that I can attend the appointment. It's about audio engagement. That doesn't work for deaf people. We know that little information is available in accessible formats. And whilst we are catering for people who use a number of preferred languages, there's very little available in BSL. We also know that very few health or care professionals have had deaf awareness training. It's something that should be mandatory. Very few staff have much knowledge about sign language. I remember many years ago when I used to work as a community mental health nurse, I would visit acute admission units, and I remember meeting a deaf man, and he was there meeting with a sign language interpreter, and I just thought, wow, what is that like to not only be deaf, to be extremely unwell, but to be in an environment where probably none of the nurses know how to book an interpreter, have had deaf awareness training, or know any sign language. Certainly there are areas where people are quite disadvantaged. So the Equality Act, which many of us are familiar with, covers areas of discrimination. But when we think of equality, that's about treating everybody the same. And it should be more about equity and fairness, treating people individually according to their actual needs. So we know in terms of policy and decision makers, it's not always possible to have a specialist service for everybody, but very often when we tweak and change existing services, that improves accessibility for everybody. And of course, in Wales, we have standards for accessible communication. And in terms of legally, we know that so far, Scotland are the only UK country to have legal recognition of British Sign Language when they produced the BSL Scotland Act back in 2015. So these are some things as a backdrop useful to bear in mind. And some of you may have seen the Oscar-winning short film, A Silent Child. So you can see here in the picture, there is the story of Libby. Libby is 4 years old, she's a deaf girl, and she has an experience of meeting a social worker who is able to sign. And I'll come a bit more to deaf younger people in just a moment. Deafness affects around 1 in 5 of the population. And so we are thinking in terms of children, that there are 34 million deaf children worldwide. That's about 2,500 deaf children in the UK who are likely to be born into a hearing family. 90% of deaf children are born into hearing families where people have little knowledge or understanding of deafness. And so as they grow, we know that deaf people are far more at risk of mental health problems. So we talk about the 1 in 4 figure. 1 in 4 of us will experience a mental health problem at some point in our lifetime. But actually the figure is twice that in deaf communities. It's not deafness that causes mental health problems, but the challenges of living in a hearing world where the systems that exist very much create some of these inequities that we have been talking about already. And so this impacts not only on people's communication and language development, but on people's engagement with others, understanding about motivation, emotional development, and ultimately people's mental health. And in terms of the pandemic, obviously there's a further context here, so that everybody has been disadvantaged by the pandemic. But when we consider issues to do with communication, education, isolation, and mental health, we know that the impact has been greater for some communities. And whilst face masks are essential for controlling the virus, they actually prevent deaf people from lip reading and understanding facial expressions, which are key if you use a signed language. Few people wear a clear mask like the one in the top picture, and so there's been further disadvantage for deaf children and deaf adults as well. So in terms of setting out some of the challenges and reasons, when you want to look at researching an area to improve research quality, to improve people's actual experience of services, what are you working with? So let's think for a moment about how are our engagements with health services actually noted and recorded? Well, we know that they're coded. We know that there's some potential here in terms of population health science, but actually it depends what is recorded and how that is coded. So if I was deaf, I wouldn't necessarily be recorded as deaf on my GP records. And I found that quite surprising. Very often, people don't know what services exist and what could help them. And that's one factor that influences people not coming forward or not asking for help in the first place. If communities have had a negative experience with services, they are not likely to return and try again. And so this general lack of awareness on both parts of health professionals and in deaf communities about what might be available starts to really set a backdrop for some of the challenges and reasons that exist in terms of provision and people's experiences of it. So, what did I do? Well, I was very pleased to engage with Cherish a couple of years ago. Cherish is all about challenging human environments. And when we think about the DE part in Cherish D, digital economies, this is all about digital consumers, technologies, possibilities, and citizens. For me, the whole challenging human environments is about how can we make a difference to people's lives? How can we, in terms of deaf mental health issues, how can we work together to develop some real innovations here? So I started at the beginning by asking some of my own networks in Wales in mental health services and practice areas and with charities to ask about what people knew. And this seemed to be an area where very little was actually known. So I collaborated with one of our Welsh health boards, with the sensory loss lead there, and very quickly was welcomed into the All Wales Deaf Mental Health and Wellbeing Group and engaged in a scoping exercise about mental health services in Wales for deaf people. Very often it was about trying to see what was out there, benchmarking with other services like the University of Manchester, Their sword group is all about social research with deaf people. And I've learned an enormous amount from other services and research centres. So when you have identified a specific society need or a research gap, there's a need to raise awareness. And so we responded to a call for evidence from the Centre for Mental Health. We developed a short film in BSL about mental health issues, and then also considered, what can we do next? Well, it's very much about engaging with stakeholders. And so taking this out of the university setting, a group of stakeholders met just over a year ago at the Swansea Centre for Deaf People. We collaborated with people from health, care, education, a number of deaf charities, and the idea to form a network was born. This is part of a mind map that we developed at the time, exploring initial ideas of how can we look at research, how can we improve services and practices that people experience. So the idea of a national competition for deaf young people and deaf adults was born to name the new Deaf Mental Health Research Network. And so this is what happened next. So I apologise that this is a wordy slide, but I thought it might be interesting to see the exact wording that was used on our grant application at the time. I collaborated with a leading charity, the British Society for Mental Health and Deafness. And what we did was set out to develop a collaborative model, engaging with deaf communities, to develop a web page, have a competition, and to really just start the ball rolling, because the first part of engagement is always about communication. So I'll just leave that there for you to read for a moment. The beginnings of early ideas are so important in research. We must not work in isolation. We must work with other people. And of course, help and suggestions are absolutely essential. And so this is our newly polished web page with thanks to our marketing team. That tells a little bit about tackling inequalities in deaf mental health research. There's our new logo that tells you that the Mental Health Research Network is all about emotional health. It's all about access and focusing on those issues. There's a link to our newsletter, and I'm happy to send the link on to you afterwards. And so in terms of where do we go from here, we need to engage with people. I'm pleased to say that the early feedback on the website and newsletter has been extremely positive. I've had a number of potential researchers contacting me already this week who are keen to progress discussions and research ideas. And so there are some of the relevant things you'd expect to find on the website in terms of a privacy notice and how we might engage with people in the future, with online ideathons, which are very feasible in the current climate. Early days, something that is very organic. You have to start with that public engagement. And so as we think about finding solutions together, developing our networks with key stakeholders is really important. So you can see the National Deaf Children's Society continuing to work with the British Society for Mental Health and Deafness will be key stakeholders as we continue to move forwards. As will deaf individuals, deaf young people, families with members who are deaf, people who know and understand deaf history. I've been fortunate to have some feedback from some reviewers of my grant applications in the last few months. And as I am an emerging early career researcher, it's really helpful to take feedback on board. Comments have been made to me that I'm a hearing person, and it would be helpful for me to have a deaf academic mentor to help me engage and understand more about deaf communities and about how to research in the deaf world. It's really important that we ask people how they might link with us, who we are perhaps looking to engage with, not as participants, but as actual members of project steering groups, right at the very early idea stages of research, bids and project ideas. Because the digital possibilities here are wide and varied. So if we consider now for a moment, what have we been seeing and experiencing? I know that people very often want health interventions to be face-to-face. And so for deaf people, continuing to use local interpreters will always remain really important. As we are now meeting together on Zoom or Teams or different platforms, thinking about etiquette when we are working with people who are deaf, having our cameras on or off, whatever is agreed, how we pin interpreter videos, again, it's essential that people know and work within those parameters. We've started to see an increase during the pandemic in deaf people using apps. So these are video conferencing platforms that can engage a live interpreter. There are a number of companies who offer this service. Equally, in hospitals, there has been the facility to bring iPads to the bedside so that when people are explaining and engaging, that there is an interpreter who is part of that discussion, making information accessible for everybody. But we have to be careful here, because if I was deaf and I was discussing a personal issue that might be to do with my health, it could be to do with safety or abuse, then having a third person in that conversation may not always be appropriate. So certainly deaf people want to engage more with deaf trained professionals to have a one-to-one conversation. We are seeing a huge increase, not only in apps, but in other digital technologies that can really improve people's health. And we also know that during the pandemic, we've certainly seen an increase in some of our deaf charities like the British Deaf Association and Sign Health, really going the extra mile and doing daily signed videos to update people about all the pandemic information. They've been doing a fantastic job. So where does that leave us? Well, it leaves us with a myriad of ideas and digital possibilities. I've emphasised that starting together, starting from the beginning, is so important. The work that groups do together nationally to engage with policy and decision makers is really important in terms of progressing early conversations, making sure the right people are around the table. And as we move forward with innovative research, it needs to be interdisciplinary. We need to be engaging with digital innovators, with industry, as well as our key stakeholders who really know what the key issues are, how we can improve not only deaf mental health research, but issues that affect deaf communities to improve deaf people's mental health overall. So I've come to the end of my presentation, and I'd like to thank you for watching, and I'm happy to take any questions by email. You can see that there on the screen, or we can have some discussions here as well. Thank you.